And now, please welcome CHCI Fellow Eduardo Gutierrez.
Good afternoon. I'm Eduardo Gutierrez, the CHCI Child Welfare Postgraduate Fellow. I am delighted to be with you today for the Caring for the Changing Latino Family session. Growing up in Delano, California, a predominantly farm worker town, I witnessed firsthand how a person's zip code can dictate their health outcomes. I'm excited to hear more about what proposed solutions come out of this conversation in order to improve the health and well-being of Latino families. On behalf of CHCI, I would like to thank Bayer, Casey Family Programs, Organon, and United Health Group for their generous support of this session. It is now my honor to introduce welcoming remarks from Session Chair Representative Silvia Garcia. Representative Garcia was first elected to the House in 2018 and is the first Latina ever to represent Texas' 29th Congressional District. She sits on the Financial Services Committee and the Select Committee on the Weaponization of the Federal Government. Congresswoman Silvia Garcia.
Well, I expected a little more. Come on now. You're in Washington. You're here at the Congressional Institute. You're here for, how many of y'all are here for the first time in Washington? Oh, everybody's repeaters. Maybe I should ask you for directions to go back to the Capitol. But first of all, let me thank CHCI for the invitation to have an opportunity to just say a few words to you, and I'll probably see you at the gala on Thursday night, and to make sure that you know that the Congressional Hispanic Caucus is alive and well, and that we continue in the fight for economic justice and prosperity and a good quality of life for all of Latinos across America. We were a growing population, and I don't know about you, but in Texas, we're especially proud that this year, for the first time, Latinos are the largest ethnic group in Texas. We're over 40%. So where's a group from Texas? I expected more out of you on that one. So you will be seeing more and more people like me or with my last name, Garcia, as we grow the ranks not only in Texas, but California, New Mexico, Arizona, Nevada. We're everywhere, and we're here to stay. We're not afraid, and we're going to support all our brothers and sisters. So my job is to just say welcome and also to spotlight how important it is that we look at the intergenerational households that comprise about a quarter of us. About a quarter of the Latinos have intergenerational households. Now, that's a big word to just say we're doing what we've always done. Todos vivimos juntos. La abuelita, la tía, la comadre, whoever needs space, we make room for them. And I still remember when my aunt would call that she was coming over to visit us, and we would immediately get off the phone and say, échale más agua a los frijoles porque ya viene tía Belinda. Didn't you all experience something like that? It didn't matter. We just added more water to the soup or water to the beans. We made room for the tía that was having problems in the city so she could come and stay with us. That's who we are. But it does present some challenges in education, in employment, in housing, and of course, access to health care. And I can tell you that the Congressional Hispanic Caucus and House Democrats are working really hard to keep the focus and the highlight on the needs of the American people, to make sure that we take care of health care by reducing drug prices and negotiating the Medicare prescription drug prices, by lowering the cost of insulin to $35, by providing more health care and opportunities through investments in our own community. Through community project funding, I've been able to have more money for my federally health qualified health clinics. for a lot of our food programs, for SNAP and our food bank, and of course, more importantly, to make sure that our families receive the child tax credit during the pandemic. And many of us still are working hard to make that permanent. That's what it takes. It's investments to make sure that we take care of people and stop the nonsense and the side shows of trying to do an impeachment, trying to say no more money to Ukraine, no more money to this, no more money to that. We need to stay laser focused on taking care of our families and taking care of the middle class. So for me, it's a simple thing because I just continue to do the work that I think we need to do for Latinos since I first got started many years ago, because regrettably, some things don't change. We still have to work hard to make sure that we get our seat at the table. We've got to work hard to make sure that we're heard and that we're listened to, and to make sure that as we do that, that we grow the pipeline to make sure that there's always a voice for Latinos everywhere. Because the mission is about the same. It's about making sure that we have a brighter, healthier Latino community. So thank you all for coming. Enjoy your time here this week. And whatever you do, do it right. Se portan bien. Bye-bye. Gracias.
Thank you, Congresswoman Silvia Garcia. It is now my pleasure to introduce our opening speaker, Dr. Juan Camilo Arjona Ferreira, Chief Medical Officer, Research and Development for Argonon.
Thank you so much, and good afternoon. I'm Juan Camilo Arjona Ferreira. I'm Chief Medical Officer at Argonon, a company dedicated to women's health. It is truly a privilege to speak before this plenary that is focused on a topic that resonates deeply with all of us, caring for the evolving Latino family. As a Colombian OBGYN who embarked on a journey to the US 20 years ago, I understand that the tapestry of the Latino family. Like many, my journey carried the hopes and dreams of generations transcending borders. Family is the cornerstone of our identity. And as we navigate the currents of change, we must ensure that our values and connections remain intact. Women play a pivotal role in the Latino family. From abuelas passing down wisdom to tias nurturing community, women are the foundation of our culture. Their strength drives progress, and their influence ripples through generations. Empowering women and ensuring that our systems support them isn't just a matter of principle. It's a catalyst for positive change in every sphere. Today, our focus also extends to Latino caregivers and those who need care, navigating shifting familial expectations. Many Latino households remain multi-generational, with children supporting older generations. Yet, some aging Latino parents may begin to find that this is not guaranteed as their children pursue careers or care for the next generation. Changes in household care bring challenges and opportunities. With that in mind, how do we harmonize the wisdom of our elders with the ambition of our youth? How do we create an environment where past and future coalesce into success? How can we leverage technology to improve access to culturally responsive, multilingual care and reduce health disparities? I'm thankful for CHCI's efforts to answer these questions, and thankful for their continued advocacy for the healthcare rights, human services, and opportunities for all Latinos. I look forward to the upcoming conversation and to our collective empowerment of the evolving Latino family, nurturing the flame of tradition while embracing the boundless possibilities of the future. Thank you.
Thank you, Dr. Juan Camilo Arjona Ferreira. It is now my pleasure to introduce today's moderator, Edwin Pitti. Edwin is a national correspondent of Televisa Univision, focusing on comprehensive coverage of the White House, Congress, and the federal government. He recently earned his first National Emmy Award from the National Academy of Television Arts and Sciences for his contribution to Noticiero Univision, the most watched Spanish language newscast in the nation. Please welcome Edwin Pitti.
Good afternoon, everybody. How are you today? ¿Cómo están? Thank you so much for having me. I'm very happy to be here today. I was told earlier that I was coming to a salsa class, but they just told me backstage that we are supposed to be talking about healthcare among the Latino community, so we're gonna get to it. No salsa today, so I'm not gonna be the one giving you all the information. For that reason, we have invited 4 amazing panelists that will be discussing many issues that are so important for nuestra comunidad, the Hispanic community. So please help me welcome Rita Carreon, Vice President of Health from Unidos US. Hola Rita, bienvenida. Let's welcome Dr. Jaime Murillo, Senior Vice President, CMO Strategy and Innovation for United Health Group. Jaime, bienvenido, Dr. Jaime. Next, welcome Dr. Rodrigo Dominguez Villegas, Director of Research at UCLA Latino Policy for Politics Institute. You guys didn't do that for me.
Not me either.
It's okay, I'm not gonna take it personal. And lastly, let's welcome Dr. Angie Lee, Senior Medical Director, Women's Healthcare, U.S. Medical Affairs for Bayer. And there you have it. And the next Miss Universe is, no, I'm just kidding. Let's have a seat. Let's get serious now, guys. Thank you so much, everybody. Before we start, I want to invite you to submit any comments that you might have using the hashtag that we have built for you guys today. Is CHCIHHM23. The hashtag is CHCIHH23. Now, today we want to talk about caring for the changing Latino families. That is a topic that is very close to my heart. My wife is actually in the Army. She's a medical service officer. So any topic related to healthcare among Latinos is always present at our dinner table. So when they invited me, I couldn't say no. I couldn't pass this opportunity to learn from all of you. So getting into it immediately, we do know that a lot of Latinos are living in intergenerational homes, and that has been key when it comes to taking care of our elders, nuestros abuelitos. But in the last couple of years, we are seeing a trend where younger Latinos are walking away from that figure, and that in a way is not becoming the most positive thing. So how can we translate that into a new way to benefit the Latino community when it comes to having access to better healthcare and well-being? Rita.
So, buenas tardes, buen provecho. I think the big question to me, and I know when we've been talking about caregivers, I would love to know, by just a show of hands, how many of you self-identify yourself as a caregiver?
Wow.
So, and I would hopefully, by the end of this conversation, we can probably understand that that's actually a much bigger definition of what we're thinking about in terms of caregiving. And oftentimes it's that individual that's caring for a loved one who may be ill, who may be disabled, who may have special needs, and or, in another different ways. And oftentimes for Latinos, which we are the second largest community that cares for our families, are considered caregivers. We're 8 million strong, but one of the areas for us is that we are an indispensable force, meaning that many of our roles that we play in not only with our familia, and because we live in intergenerational homes, we're often playing care for our loved ones, but we're also caring for the rest of the familia. And that role that we play is not only just at home, but we're also have jobs and are working, 100% of our time. So there's a lot of stress that comes into that. So I just want to kind of make sure that we're level setting, because oftentimes when we think about caregivers, it often steers into the conversation around our elderly, our abuelitas, our fathers, our young children. But I think the one thing is that we don't talk about the young children, and the young children that may have special needs, maybe on the spectrum, or have another condition that really requires not just how we're caring for them within the healthcare system, but also within the schools that they're navigating and in the community that we're navigating. So there's a lot of stress that we think through, but there is a lot of resilience and a lot of pride in being a caregiver.
Thank you, Rita. 8 million Latinos are caregivers. That's a huge number, which leads to the next question, that there is definitely a financial impact when it comes to that. Rodrigo, Dr. Rodrigo, are there any numbers to back that up?
Yes. Hi, everybody. Buen provecho. Let's start with the fact that 26% of Latinos live in intergenerational households. That's way more than the general population, which is at 18%, and definitely way more than non-Hispanic whites at 13%. Why is it that they live in intergenerational households? There's a mix of reasons. One is because we care about our familia and we want to care for them. But Pew did a study asking people, why do you live in intergenerational households? And 67% of adults said that it was financial issues that is the main reason why they live in that setting, right? And so there's a mix of things about financial issues. One is that living in an intergenerational household is a protective factor where we can pool resources if we all live together, or if someone gets unemployed, the other one can chip in, right? But then there's the other part, which are the prohibitive costs of housing or childcare or elder care. And to me, it's all about choice, right? The first question was, are young Latinos leaving and moving out of intergenerational households? Maybe many of them are. And the important thing is for people to have a choice and to overcome the structural barriers that I mentioned, housing, childcare, elder care, so that we can make a choice as to what is it best for our family and how can we best live.
Dr. Jaime, I want to ask you, what would be some of the healthcare and well-being needs that our community is having right now?
Yes, good afternoon, everyone. Edwin was disappointed that he didn't find any empanadas for lunch, but I'm sure you're enjoying it anyway. As Rita was talking, I was just thinking about the cultural part of healthcare, or how we care within our families. And I remember having the privilege, I was privileged to be a primary care doctor in the rural community in the mountains of Colombia, and used to seeing the patients in the rooms and the whole family around. And one of the things that I remember the most when I first came to the United States was that being at the hospital doing rounds, and it was maybe the patient or maybe one person. I said, how come the whole family is not here around? So it's fascinating to see how we perceive, caring for our own family, and know that it's just a cultural thing, and we need to understand that. So that's a piece that I think we definitely have clear is that there's not a single formula for everyone within healthcare. And think about this, we have always thought that healthcare is a relationship between a doctor and a patient, is a one-to-one. The reality is actually one to many, and that is one to the family, because I always encourage my patients and said, please come with someone, because you will have more questions that I can answer for you, and secondly, 2 or 3 people will remember more of what I said, and then I learn more from you, because very often our husbands are classic. They come and they say, do you have insurance of breath? Oh, I'm fine, doc. And the wife would say, oh no, you're being very short of breath. So that information is just fascinating. So for us to understand the dynamics of how people care, especially with the Latino communities. And then the other part is that we'll talk more later, is how we can engage the family within the care of every single person.
Yes.
It's not just about, here's your prescription, see you later. It is, is how to make sure that that person is going to get the prescription, is going to take the pills, why are they taking those pills, what else besides the pills is necessary, the care around changing the diet, the exercise, the activity part, and so on. And that really involves including the family and the caregivers.
Dr. Angie, are there any trends when it comes to the needs within the Latino community when we talk about healthcare?
I am Angie Lee. Hello. I am not a Latina person, but I am definitely an ally. And as an OBGYN, I have been a lifelong supporter and advocate for women's health. The trends that we are seeing are related to the common theme of women are deprioritizing their health. They are putting others first. Their family members are coming first. I think that we can all agree that women carry much of the responsibility in a family. They are working inside the home, working outside the home, just like as Rita had mentioned. They are making sure everybody is going to the right place at the right time, and they are also in a multi-generational family. They're also taking care of extra caregiving responsibilities. So with all these pressures and everybody else coming first, then often women will deprioritize their own health care, and that kind of makes its way down the list. So as a result, then what we are seeing are a decline in breast cancer screening, a decline in cervical cancer screening, and unfortunately, the rates of sexually transmitted infections are on the rise. And unintended pregnancies the rates are very high. So unintended pregnancies can, unexpectedly take a woman out of the workforce, and it can affect her her career trajectory. She may not get the promotion in the same timing because she was on maternity leave. She may not be able to have her educational goals may be negatively impacted. So the Guttmacher Institute references that unintended pregnancies affect Latina women at a rate that is more than double that of their non-Hispanic white counterparts. Also, Latina women are less likely to be using the most effective forms of birth control, like long-acting reversible contraception. And certainly misinformation and disinformation abounds, even on social media. And so what we're seeing is that all of these downstream effects of women deprioritizing their health and their well-being, that these downstream effects can be quite significant.
Dr. Rodrigo, how important it is to keep an eye on all of these trends?
Well, it's incredibly important. I also think that it's incredibly important to zoom out a little bit and think about the structural factors that are leading women or other people to deprioritize their health. So some of the research that we do at the UCLA Latino Policy and Politics Institute is showing some, difficult changes that are at the structure limiting the access that we have to healthcare. Well, first I want to start with something great, right? Latinos live 1.6 years longer than the average American. Woo! We are chingones and chingonas, and we live longer than the rest. And so the narrative about Latinos kind of like not being healthy, et cetera, is so strong in the media that we always forget about this, which is what people call the Latino paradox. In many outcomes for health, Latinos do better than others. But there are some trends that are worrying and that are important to keep an eye on. First, we need to continue to expand access to healthcare. There's 19% of Latinos are still uninsured, even though there was a lot of progress made by the Affordable Care Act. If we look at Latinos that do not have citizenship, that rate is 45%. Second, the Dobbs decision and legislatures around the country are taking away women's right to reproductive health. So we've got to be paying attention to that. And third, you always hear the need to have culturally and linguistically capable healthcare or things like that. We need to speed up the training for Latino physicians, right? Even though Latinos make up 20% of the population, only 6.3% of physicians in the country are Latino, and only 2.4% of Latino physicians in the country are Latina. So there's a lot of things that we can, despite our better health outcomes, we could be healthier and we could do better if we pay attention to these trends.
Dr. Jaime, go ahead.
Yeah, well, you just threw a lot of information there. It would be fun to talk about. So one is those trends. At United Health Group, we have the fortune of having access to data on 80 million people, and we look at those trends very carefully. And within the Hispanic population, we see what is happening. And you can start doing those analysis based on nuances like what are the healthcare trends among those who are immigrants and those who are first generation born in the US. And it's actually a little concerning. Interestingly enough, the Latino paradox that Dr. Rodrigo alluded to, I'm going to give you better news. It's expected it's going to go up even to longevity to 86.3 years, as opposed to 79 for the rest of the population. So we're still living longer. And part of that, even though we don't know exactly why, I think part of that is what we just talked about, which is people care about each other. And we save the lives of our own ones because we are constantly checking on the abuelitas and so on. So we need to keep that tradition from the cultural standpoint. In terms of the access, that's a major, major, major problem. Even though the Latino population earn less, has less access, and less emphasis on prevention that Angie just alluded to, we still live longer, but I think we need to pay more attention. So how do we do that? We reached out. We don't, and I know we'll talk about that, but we need to go out where people live, work, pray, and play, because we cannot wait for people to come to us. The Latino culture is, well, I go to the doctor when I have a problem. What about if we just go to them before they actually have a problem? So that's going to be a huge emphasis that we need to make on is how to reach out. And I know Rita is very knowledgeable about the community. She's ready.
You guys are talking that we Latinos are living longer, but even though we are living longer, there are still social determinants that are impacting our health negatively. Could you guys mention some of them? Rodrigo?
Totally. So what are the social determinants of health? Basically, it is all the economic and environmental factors that impact our health, ranging from income to access to transportation. I think something that's really important in understanding social determinants of health right now is that it's important to focus into the very specific profiles of people. And what does that mean? Having disaggregated data, not just about Latinos overall, but about Latinos based on national origin, sex, citizenship and nativity, language, and many other characteristics that we know impact our access to resources. Lucky for you, the UCLA Latino Policy and Politics Institute is putting together something called Latino Data Hub. You probably all had a little flyer on your chair, and that's what it is. We're putting together this data platform where we're going to give you indicators for over 80 different indicators on a wide range of issues, and the most important thing is that data is going to be disaggregated by all the characteristics that I mentioned, and you can get that data at the national, state, and county levels. But you mentioned what are some of the social determinants of health. In the sake of time, I think besides housing and even access to broadband internet, there are two that are particularly important for Latinos. One is language, and the other one is citizenship. We see across almost every indicator that those who have not had access to citizenship always fare worse off than the rest of us.
Now, I need Rita and Dr. Jaime here, because there has been some initiatives nationwide that have been successful when it comes to helping the Latino community to access better health care. How can we duplicate those in other communities that are not having the same luck? Rita.
So I do want to come back to the social determinants of health, because oftentimes we say it, we also say political determinants of health, and what does that necessarily mean on the day-to-day basis?
Sure.
And oftentimes, and this goes back to those strategies and how do we pinpoint. So at Unidos US, being the largest Latino civil rights and advocacy organization, we have close to 300 community-based organizations, including federally qualified health centers. These are the trusted organizations that are in community know what's happening on every single level of what that individual is going through. And whether we are measuring the data, which we're seeing a lot more with health insurance companies, and the data that Dr. Rodrigo mentioned in terms of just your education, your immigration status, whether you own a home or not, what's your economic trajectory, what does the housing situation look like for you, and a number of different factors. There are also systemic racism that has been born with what we don't often talk about in terms of our policies that we're being pushed and pulled together. When we talk about immigrants in healthcare, we know that they're often left out of the picture of having access to care. We know that a lot of the California being one, as well as Illinois, really passing legislation to ensure that Latinos and anyone who's immigrant under the age of 40 is able to access care. And just recently, when that happened, the governor had stopped that because we were so successful, and they were afraid that the budget was going to come to an end. But here's another thing: when you really, address the policy levers, you also address the community levers. And so these strategies are super important in terms of looking at Latinos and the communities that we serve in a very holistic way. And when I say that, it means that, the work that Unidos does is not only on health, but it's also on housing, economic empowerment, education, workforce development, and immigration, civic engagement, and you can mention every single little thing, but I think the big thing here is that you have to meet a person from where they are and where they're coming from. And coming off of the pandemic, and we know that there's another level of high rise of COVID, but what does that look like for our community? We've been the most impacted, one of the most impacted communities, but when we have education and outreach and you invest resources in the community, you're able to close that gap like we did with the first series of vaccines. So that was incredible, and that was largely because of public and private partnerships, researchers, everyone was in it together and making sure that we were putting that together. I think a big thing also is the opportunity that community, not only CBOs, but community health workers or promotores de salud play in this role, because they are also from the community. They're trusted, they understand, they're super smart in the resources and being able to navigate not only where health happens, which oftentimes that's outside of the community, but also within the healthcare system. However, they're also burned out, just as much as caregivers are also burned out. So we need to make sure that we're taking care, it's time to take care of our caregivers, making sure that we're taking care of our workforce. So one of the concepts that we're coming from is also how do we elevate the skill sets of promotores into the next level in terms of their own trajectory in the profession, whether they want to go into social services or mental health, which is one of the largest, biggest threat for our community currently in terms of how we're showing up with each other, and other areas, administration, which is just as critical, because if you're in an administrative position, you are able to make decisions and where the money goes. So there's a lot of power in how we think about the different strategies. There's not one solution, and every neighborhood looks different. Every situation looks different, but I think relationships are just as important in how we think about the power of our community. I do want to go back, and I'm sorry, I'm talking a lot, but I think one thing is this expected cultural responsibility of caregivers. Very proud of taking care of our father, of our kids, or of our abuelitas, but we're also quietly overwhelmed. We don't talk about the stress that's going on in our lives. And that's super important for us to figure out and assess, listen, are you doing okay? And if you're not, how can I help you? And that's super important.
It is super important. Dr. Jaime, how can we replicate those strategies that have been successful across the country?
Yeah, one of the biggest opportunities that we have in healthcare is that we need to change the paradigm of how we do healthcare today. Imagine we wait in our offices for the people to come, and the doctor is overburdened, is overwhelmed with a lot, trying to see everybody in their offices. How about if we actually go to the community, as I mentioned earlier? And how do we do that? One, we need to partner with the community. That trust of us going over there has to be earned by aligning ourselves with those within the community. Number two, we need to extend the care team. It's not just about the doctor doing everything. And you mentioned the promotora de salud. I remember when I was a primary care physician, I had a promotora de salud going to different veredas and telling me, oh, we need vaccination here, we need blood pressure control here, and so on, child, pediatric, and so on. Huge part of the team, so extended care team. Number three, we need to provide more personalized care, and that means more culturally appropriate and using workforce that are also concordant, meaning, I understand the language, I'm part of your community, I know where you're coming from, I understand every single term that you use. And the last point that I'll make is the use of technology. We can use technology to connect with people, especially those in rural areas. We cannot expect that everybody's going to be able to take time off work, pay a copay, be in a waiting room waiting for 2 hours, and then leave and said, oh, I forgot to ask the doctor. Now you have to wait another 3 months to ask that question. So that technology needs to keep us connected and also use it as a signal for us to know what we're doing well and what we need to improve. Right now, for instance, we're involved in a hypertension control community engagement initiative where we just literally go to the community, find the people who have blood pressure. Remember, for those of you who know, half of this group is, statistically speaking, I'm not saying, but statistically speaking, half of this group has high blood pressure. So what that means is that most people may not even know. It's called the #1 silent killer. So we need to detect that before we have complications. So we're going to the community, finding those people, treating them at home, and using technology to make sure that the treatments are the right ones. So a lot of good work ahead of us, exciting.
Rita, what else can be done when it comes to engaging people to promote that communication between organizations, hospitals, and the Latino community?
I think a lot of it is knowing your power and your voice. Like, don't miss the opportunity to be in the room with people that are decision makers and include yourself into the decision-making process. We did a lot of work during COVID of ensuring that community-based organizations were at the table and also resourced. When everyone went home, went back, work from home or whatever that looked like, our CBOs were still open because the community was knocking at their door because they needed food, because they needed to make sure that they could make the rent, and or because they lost their job. So there is a lot of levers in terms of how you think about engaging community is really, again, meeting them where they're at, but also making sure that regardless of what title you have or whatever table you're at, the next person in telling your story can be somebody who can open the door for a bigger solution, both on the policy levers, but also on the community. And I think that's I think personally, with even the promotoras, they know how to ask the right questions. I think our biggest stress is misinformation. Oftentimes, there's a lot of spread of misinformation and disinformation, and we need to really ensure that we're not only fighting for our community, getting people registered to vote, and ensuring that we're showing up at the polling stations, but also in every single place where you're needed.
I'm proud to say that I'm seeing some familiar faces of people that are really working hard to assist the Latino community. But I do want to ask Dr. Rodrigo, what else can we do when it comes to empowering Latinos to make sure they have a seat on the table where these decisions are being made, especially when it comes to policy?
Yeah, well, there's that saying, right? If you're not at the table, you're on the menu. It is incredibly important to enhance that. I want to, for instance, I think we need to transform systems so that more Latinos are are sitting at the table. And we need to change the table too, many times, because those tables were not designed for us and by us. And so it's not just about granting access, for Latinos to the tables that are already set up, that were set up in a system that's not set up for us or by us. We need to transform the systems, and then, and of course, definitely have much more representation at every single table.
Great. I want to focus now on the health of Latinas, and I'll go with you, Dr. Angie. What type of trends have you seen, and what else can we do to empower Latinas to continue to take care of themselves?
I think that firstly, we need to recognize that it is such an important question, but yet a really complex and a multi-layered question. I think that if we all can recognize that this is not a one-person job, like that there's no one group that can solve this, very gargantuan problem. So it's going to take a village approach. It's going to be an entire ecosystem that is recognizing that and prioritizing women's health care, amplifying, getting that message out, telling women, hey, you're important and your health and your well-being is important. And then, getting that message to the caregivers as well. The strategies, first, I think that the first is recognizing that how do people consume information? How do they, who do they trust? They tend to trust people within their communities. So they often look within their communities for this kind of information. So I think we need to recognize that social media can reach communities and micro-communities in a very unique way. So I think that's an important recognition. Secondly, we talked about partnership. So, this is a public-private partnership that's going to be necessary on every level. So we need to get all the stakeholders, patient advocacy groups, we need government agencies, we need, private industry representation, we need everyone, professional societies, we need everybody to come together because everybody's got a piece of the puzzle that they can solve, but that's only one facet. So we really need to bring everyone together and let's all link arms like we are on stage now, and let's link arms and partner together because it's such a complex issue.
Dr. Jaime?
Yeah, as a cardiologist, I shouldn't be talking about women's health, but the reality has been always a passion of mine while I practice because we don't take women within cardiology and other area as seriously as we should, and we don't understand them. And we need to be also on the cultural side. Breast cancer, cervical cancer, we know that with vaccination, with mammograms, we can prevent a lot of those cancers and deaths. So that's an area where I think we have an opportunity because the Latino community I mentioned earlier, we're not used to prevention. Yeah. So if we send the message out instead, you need to have this testing and these vaccines so you can prevent those, that's an important messaging through those promotores de salud or community health workers. Number two, we need to be sensitive to the cultural beliefs. Perfect example, especially on the maternity side. We know that cardiovascular complications are one of the main ones in terms of pregnancy. Aside from the African American population, the Latino women have the highest rate of cardiovascular pregnancy-related complications. So think about that woman who comes from El Salvador, has a baby here, has been told that she has to stay for 40 days inside the house, dark, no windows open, fully clothed, and that person is going to stay sitting there. My mother died at the age of 32 from pulmonary embolism, meaning clots that went from the legs to the lungs. And I'm feeling here vulnerable telling you this story, but it tells you how close I feel about the need for us to be more proactive. And if that person believes in that, then we should have someone going to the house and engaging that person in their care. And we should start educating the other people about the need for care post-delivery. Once you have the baby, we need to make sure your blood pressure is okay. We need to make sure that there are no early signs of anything that we can treat. So that engaging people in a cultural way within their own homes, that is definitely has to be part of the healthcare moving forward.
Well,
I do want to add to, as a Latina, yes. and born in California, Mexican American, my father came through the Bracero program. My mother was, what they call a stay-at-home mom, but she was an entrepreneur in her own ways. There is this issue around that we often don't talk about, and even the situation and the experience that you led is like how mental health really impacts our community. And we see it on not only postpartum in regards to the baby blues, but we are living in that silence because there's a level of expectation that, I now have to be the mother and I've got to take care of my children. There's this level that it's culturally intertwined generationally, but then also I think the important thing here is to note that the current conversation is that I can do it on my own, that I can do it all. Here I am, right? And we saw that coming off of the pandemic, that our situations are much more far worse in terms of not going in to get the preventive care, having not being in compliance with whatever chronic condition, whether it's diabetes or heart disease, and or living silently in your own anxiety or social isolation. And often caregivers, because they're taking on that role for caring for others, they're also not able to care for themselves. And what I want people to come off of this conversation is that you don't have to be on your own. There are resources, there's assistance now, and we have to demand that for not only ourselves, but for our families and for the next generation. And that's important, whether there's technology that's currently out and available, and elevating what that looks like and taking advantage or breaking down systems, political systems that no longer work for us. Don't get comfortable. Don't get comfortable of where we're at, because there's still a lot of grief. There's still a lot of work that we need to do. And that's the big challenge, that we need to not only support our caregivers, but also support our familia, because there's a lot of tradition there that we need to continue.
That was beautifully said, and I think this is a perfect layaway to open the floor. Are you guys okay if we take some questions?
Totally.
If anybody has any questions, feel free to raise your hand and we'll make sure to bring a mic to your table. We have a lady on the left side, first table. If you can get up, please, so they can see you.
My glasses on.
All right. Hi, I'm from El Paso, Texas, and that's right on the border of Ciudad Juárez, Mexico. My family and many other El Paso families cross the border to get access to health care since they're scared of going to a doctor's office or because they simply can't afford it. It's scary to think that without the healthcare professionals from Mexico, none of our families and people would be getting treated. What preventative measures is healthcare in the U.S. taking to stop the possible catastrophe of not having access to medical services in Mexico, and what are the next steps that these families can take to stop it from happening in the first place?
Who would like to answer that question?
I can take a stab. I mean, that's why the whole conversation about the border is just completely not based on facts. And it just shows the importance of really moving away from that conversation about shutting down the border. The U.S.-Mexico border is incredibly dynamic, and it brings so many people so many benefits. It's not just about trade. It is not just about immigration. It is about healthcare access and so many other things that are deficient in the United States, and that on the Mexican side you can get access to. So we've got to really complicate the conversations about the border and think about that carefully. But thank you for your question. That's really important to bring up.
Thank you. Any other question? Let me see. Let me scan the room. Where? Back there, the lady with the green jacket. If you can get up, please, so they can see you.
You have good eyes.
Yes. I can still see a little bit. There we go.
I was being a little bit shy. Mayra Alvarado, California Teachers Association. What would you say to, well, I'll start off with this disclaimer or preface it by saying that I'm a caregiver myself for my dad with early onset Alzheimer's, and that is really hard for me to say. It was so hard to get help with postpartum issues, right? With all these things that are so stigmatized to talk about in our communities. What do you think needs to happen for us as a community to be more able to openly talk about these things?
Rita? Dr. Jaime?
I think she just did it right now. I think being honest and open and transparent. I mean, I know you're being honest, but I think the big thing is being open about where you are and where you need some help. we're often afraid to ask for help. We all need it. I'll be the first one to say. And people have asked me, are you going to this event or that? And I'd be like, no, I cannot, because I've got to take care of my son. And I think the big thing here is there is a lot of stigma across multiple conditions that we have. But when we start to change that narrative to help our familia, and then we can be able to then push more for resources, for assistance, for better policies in play. And
Dr. Jaime?
Yeah, I'll add, just to give it a specific example of how we can solve for that. Number one, we know that in the Latino community, mental health is, as you said, a stigma. So we need to normalize that concept. And the way some people have approached it is the physical health and the mental health. They're all equal, they're all the same. We could use technology, for instance, to communicate. Let's say you have a chat or a tablet that you can actually speak. You don't have to read, but speak, let's say, in Spanish, and you say ask questions about mental health and so on. And people sometimes feel more comfortable talking to a device that actually telling the doctor about their mental issues. So that's a way how technology can actually get into those, kind of breaking those barriers about how people can see mental health. But it is on us to really make emphasis on, and for people to understand that it's not a stigma, that having depression treating depression is like treating diabetes. There's no difference. In fact, you could do a better job. As a cardiologist, I can tell you there are so many things we could fix just by fixing the brain, I have to admit. So there's an opportunity for us to really get into the space, because remember, alcoholism is closely tied to that. Depression, heart disease, a lot of physical conditions are actually tied to mental health.
Alzheimer's.
Alzheimer's, yes. Yeah.
Can I just add a statement?
Yes,
too?
please, Dr. Angie.
As an OBGYN, I just encourage you, like, you're a healthcare professional, they want to help. So if you tell them, like, hey, I really need help here, then, that's why we went into the business of medicine. So it's because that people, we want to be helping. So I just would encourage you. And, if you're worried about, what are people going to think? Just frankly speaking, there is, the patient and the physician confidentiality. So no one is going to know. No one needs to know that you might need some medication just for a short time. Who knows? So I would just encourage you as a healthcare person that they want to help. So just please don't be afraid to ask.
Thank you, Dr. Angie. We have time for one more question. Two more. I promise I'll come back to you. Back there.
Hi, everybody. My name is Lupe Rodriguez. I'm the executive director of the National Latina Institute for Reproductive Justice. And thanks. I'm interested to hear your perspective on the crisis that we're facing in the U.S. right now on reproductive health care access, and specifically abortion care access, which is impacting the Latino community more than any other community in this country right now. Mm-hmm. And, I didn't hear too much conversation about that, but I think it sort of connects with a lot of the other issues that we're talking about healthcare and opportunity, et cetera. And so I wonder what your perspective is on how we can work together through the various areas of healthcare work that you all are doing to combat the issue that we're facing right now. And frankly, not just an issue, a crisis that's affecting our community.
Thank you for that question. Dr. Rodrigo.
Thank you for the question, and I can contextualize that. We published a report almost immediately after the Dobbs decision, and exactly what you're saying. It is, a much higher proportion of Latinas are in childbearing age. This is being an impact on them much more than many other groups. And not only that, but Latinas living in states that have prohibitive laws and places where they have passed legislation restricting access to abortion are in the states where the Latino population is growing the fastest. So it's only gonna get a bigger proportion of Latinas are gonna live in states. So I just wanna reaffirm what you're saying, contextualize it with numbers, and in terms of the solutions, we all should think together about, I don't know if the panelists have some more ideas, but it's definitely something that the community and all of us in this room should be very carefully thinking about and addressing immediately.
Dr. Jaime, could the use of technology be helpful in this case?
Well, technology can be helpful for everything, right? Right now, we're in a range just to check my blood pressure. I'm sure it's going up while I've been here. I think it's technology in the sense that we have to be, one is use technology to identify those who are more likely to have X condition, for instance, and then be proactive about it. Technology to say, here are the resources, the areas where you can find those resources that you need. Because that's another area that we sometimes just feel like Google is everything. The reality is we need navigators to help us. And having that connectivity will also be helpful. And then technology as a way to accumulate, bring data and analyze data and see those trends across the country and say, where are the areas that we need to focus and build solutions. As we said in a United Health Group, we think globally, but we act locally.
Let's take the last question.
I do want to add that what is happening in terms of the crisis, because it is a crisis, is exactly limiting access to healthcare services.
Yeah.
At the end of the day, the right of women, but also the right of our community and those that are disenfranchised and multiple for historical reasons. Goes back to the whole political determinants of health, is that we need to make sure that our voice is heard. It's not an easy path. It's been something that our community has been working with around reproductive health and access, but it is critically important that women are also part of the picture. And we're a strong source, a resource and often the key caregivers. So whatever impacts women, Latina women, is something that we need to continue to fight for.
Thank you, Rita. Take your questions.
Hi, I think each of you have spoken very candidly about the macro picture of disparities, and each of you have a role within the healthcare system, and there's a deeper kind of culture that you've talked about of disparities outside of within the medical culture. I'm curious how each of you in your role are actively working or fighting against that internalized discrimination and disparity that exists within the health and medical field.
I'll start with you, Dr. Angie.
Wow, thank you. It's a toughie. I think that I work at Bayer, and at Bayer I'm in the women's healthcare group, and so I can speak to the women's healthcare and recognizing the disparities, and I think that what we're trying to do is we talked about getting out to the community. So we want to partner with community organizations. We are partnering with Mobile Healthcare Association. They're in smaller communities. We are working on the education front. We're trying to get as much education out there and kind of combat that misinformation and disinformation. So the more people are aware of all of their contraception options, for example, then they can choose wisely and see what fits for me at this time in my life. So I think that there are so many things that so many things to do, and we are also, working with the organizations that are able to, I was again talking about partnership. It's just such a big problem that you can't just do it alone, and so we're working with different organizations, and I don't want to spill all of the tea. But we're doing that to try to get to make an impact and to make a bigger impact together.
Thank you, Dr. Rodrigo.
Yeah, so the UCLA Latino Policy and Politics Institute is a resource for all of you, for policymakers, for the private sector, philanthropists, and others, to precisely provide those insights about structure. The Latino Data Hub will be an incredible resource for all of you to use, and what we do is precisely inform policy decisions. Besides that, UCLA does have the Center for Latino Culture and Health that has an incredible pipeline program to address something that I mentioned before, the Latino physician crisis, and to speed up the training and have more Latino physicians. And so there's, as an institution, UCLA and LPPI we do a lot of on both ends.
Dr. Jaime?
Yeah, well, I love the question. Thank you very much. I think we all recognize that it's not a single solution. So my personal story, I left cardiology because I knew there was a better way to do healthcare. And I'm fortunate to be part of United Health Group, which is 400,000 people, probably the most, you can argue, the most diversified workforce in the healthcare space. 70% women, 40% people of color, 13% are Latino. And we have active engagement. So the engagement has to be to reduce disparities in two ways, internal and external. Internally, we are making sure that those voices are heard, that we have enough diversity within the workforce. We have, since 2011, the United Health Group Foundation has spent close to $100 million in the diversity initiative for people to get trained in the healthcare space in different areas. So that diversity of the workforce is key. Representation of those, Rita mentioned, those who make decisions. We have to have Latino representation in every aspect of it, and there's a challenge to every one of you within your own organizations to promote that. And then the second piece is the external engagement, is that we need to have that stakeholders have to get together. It's not about one single organization being able to solve all the problems. And engagement, that partnership with the organization, with the community, that has to be local in order for us to start identifying where the opportunities are. So use data and technology. And you heard me talk a lot about data and technology, but I'm going to end with one thing. Remember, healthcare is a mission, was born as a mission. Everything we do has to be done with compassion and care, period.
Thank you. Rita?
I'm like, we're out of time, but I am happy to incorporate. There's different places where we sit at, but at the end of the day, it's around how can we make systemic changes within the ecosystem that we live in. And what I mean by that is whether it's in our community, whether it's in the organization that you work for or with, whether it's the connections that you're making with your representatives in the room. There are a lot of levers that you can pull to be able to ensure that we're all collectively doing the right thing. And when I say this, I see Annie Donovan over there standing from the Raza Development Fund, and she, and Unidos, the Raza Development Unidos are doing a health equity fund to ensure that we're increasing the capacity of federally qualified health centers, not only on their capital, which is super important in terms of who's paying for that building that we're going into, but also learning collaboratives where we can be able to ensure that the health centers are putting in their voice in terms of what is priority of the needs of the community. Another example is our Medicaid unwinding work, which is calling out call centers that are discriminating against Latinos who speak Spanish, who are just hanging up on them. And have been kicked out of the system without coverage, where they themselves are eligible to receive coverage. And making sure that not only our government is aware of it, the state is aware of it, but also those call centers are aware that that's not how you should be treated. And then the other thing in terms of research is, we sit in a lot of different tables with the National Institutes of Health or other organizations and federal agencies in terms of the research is changing dramatically. Precision medicine, there will be a time, and if it hasn't been already, where just your genetics, I can let you know what type of medicine you can take. And Latinos need to be part of those trials, part of the observation studies of long COVID, part of a number of different places that if we're not in working with the researchers and elevating what the future of medicine looks like, then it's not going to look and be for us in the future. So there's a lot that I can provide examples, but I do want to say that we don't have to do it alone as caregivers. We do need, it's time for change, it's time to care for our communities. And just thank you for having us.
Thank you. Unfortunately, we ran out of time. This is a topic that we could go on and on and on and on. But what I would like for you to walk away from today is knowing that even though there are many challenges when it comes to Latinos having access to healthcare, there are also many opportunities for us to partnership and work together para el beneficio de nuestra comunidad. Thank you so much for being here today. Thank you to the four of you for your expertise, and we'll see you next time.
Gracias.